Bismillahirrahmanirrahim. So I welcome you all to this video tutorial. So in this video, I will discuss the topics of the coagulopathy. As you must be aware about the term on the coagulation. So normal process जब हमारे स्किन या किसी और बॉडी पार्ट्स में जब कट लगता है so within a specified time के बाद जो है फिर नॉर्मल जो coagulation process होता है मीन सिंपली सपोज एक ब्लीडिंग जब होती है एक स्पेसिफिक एरिया पर जब कट लगता है सपोज दिस इज द ब्लड वेसल्स and suppose at this area if the cut occur so after some time later the body normal coagulation process will start so actually what is the coagulation so जैसे आप सबको पता होगा कि coagulation is the conversion of the soluble fibrinogen into insoluble fibrin. So that is the mesh-like network. So that is called the coagulation. So simply mean, as we all are aware, that the liver secretes different types of the clotting factors. जब हम जो है डिस्कस करेंगे सपोज दिस इज द लीवर एंड लीवर जो है वो डिफरेंट टाइप्स ऑफ द क्लॉटिंग फैक्टर्स जो है मोस्टली 13 different types of the clotting factors are currently under investigation जिससे आप सबको पता होगा कि फिर जो है वो क्लॉटिंग फैक्टर जब लीवर से सिक्रेट होती है सपोज और देन अगर बॉडी हमारी बॉडी में जो है किसी भी जगह पर जब कट लगती है सो विद इन स्पेसिफाइड टाइम एक लिमिट के बाद जो है फिर वहाँ पर जो नॉर्मल कोएगुलेशन प्रोसेस है जिसमें जो सॉल्युबल फिब्रिनोजेन है जो कि फैक्टर 1 है इनएक्टिव फैक्टर 1 है वो फिर जो है कन्वर्ट होता है into insoluble fibrin that is a mesh like network suppose this is the different types of the mesh like network is formed and the bleeding is stopped so this is the normal process now what happened during the coagulopathy suppose this is the mesh like network that is formed due to the process of the normal coagulation and the either the extrinsic pathway is stimulated or the intrinsic pathway is stimulated. Suppose this is if we consider that the coagulation process so you all are aware that there are two pathways for the coagulation that may be either the extrinsic pathway or that may be either the intrinsic pathway. And different factors are involved in the extrinsic as well as in the intrinsic pathway and that is responsible mainly for the coagulation और जिसकी वजह से जो है एक स्पेसिफिक टाइम पीरियड के बाद जब कट लगता है तो उसके बाद जो है एक स्पेसिफिक टाइम जिसमें जिसे हम क्लॉटिंग टाइम या ब्लीडिंग टाइम के नाम से भी जो है पहले जानते थे so after that the normal coagulation process is done and the bleeding is stopped so this is the normal process now what happened during the coagulopathies so coagulopathy it is a group of different types of the bleeding disorder जिसमें जो है either या तो genetically clotting factor की deficiency होती है suppose in the hemophilia there are different types of the hemophilia like the hemophilia A, B, and C, in which there is genetically a deficiency of the clotting factor और जिसकी वजह से फिर जो normal coagulation process है वो नहीं होती इसी तरह जो है अगर हम इन कंट्रास्ट डिस्कस करें इस coagulation process में जो different platelets हैं जिसे हम thrombocytes भी कहते हैं so either there may be the deficiency of the platelet that is called the thrombocytopenia and this is also one of the types of the coagulopathy. So now in this video tutorial, I will slightly discuss that what is actually the coagulopathy and then the what is the coagulopathy and then what are the different sign and symptom of the coagulopathy and what would be the management or the treatment of the coagulopathy. As I have already mentioned, that there are different types of the bleeding disorder that may be either the hemophilia or the thrombocytopenia or even different other types of the bleeding disorder like the idiopathic thrombocytopenic purpura and also the DICs. That is in contrast the opposite term to the bleeding disorder in which body में जो है एक specific abnormally जो है different clot form होते हैं और फिर वो जो है that may cause the ischemic heart disease a lot of trouble. This is called the DICs, disseminated intravascular coagulopathy. Now let's proceed toward the definition of the coagulopathy. So this is the chart that is the general bleeding. So simply mean coagulation screening and full blood count, जिसे हम CBC भी कहते हैं, complete blood count. So this is the different types of the bleeding disorder. As I have mentioned earlier, that the liver is responsible for the production of the different types of the clotting factors. जब liver में जो है एक problem हो और वो जो है suppose different types of the chronic disease like the hepatitis B and C और even the liver cirrhosis की वजह से जो है normally जो clotting factor है उसकी deficiency हो जाए, so that may cause the problem. Or either the as we already mentioned that either the thrombocytopenia, that is also one of the reason for the coagulopathy, जिसमें जो है नॉर्म एबनॉर्मल जो 1,50,000 to 4,50,000 नॉर्मल फेटी ब्लड काउंट है, सपोज अगर वो जो है इस स्पेसिफिक 20 टू और 50,000 से जो है अगर इस प्लेटलेट की काउंट over deciliter कम हो जाए, so that may cause the severe bleeding tendency. So this is the chart that represent the different types of the coagulopathy and their specific reasons. So now let's proceed toward the definition of the coagulopathies. So coagulopathy is a condition in which the blood ability to clot is impaired. So simply mean that this is a condition in which the normal coagulation process is not happen. So that is called the coagulopathy. This is the simple definition of the coagulopathy. This condition can cause prolonged or excessive bleeding. So it may cause the prolonged bleeding, mean continuous bleeding, or the excessive bleeding, which may occur spontaneously. And the main problem here in the coagulopathy is that the bleeding will occur either spontaneously, mean inside the GIT bleeding, etc., or followed by some injury or medical or dental procedures. इस तरह जो है हम जब दांत निकालते हैं, सो एट दैट सिचुएशन जब नॉर्मल प्रोसेस जो है नॉर्मल बॉडी होती है, सो फिर एक स्पेसिफिक टाइम लिमिट के बाद जो है वो कोएगुलेशन प्रोसेस होता है एंड द ब्लीडिंग इज स्टॉप्ड. But in the coagulopathic patient, suppose if we perform some dental procedures, so after that there may be a severe types of the bleeding or either some medical surgery or the if injury occurs, suppose if accident or trauma happen. So in the normal individual, the coagulation will done and the bleeding will stop. But in the patient of the coagulopathy, there is a normal and severe bleeding. So now the coagulopathy can be a primary medical condition. So the main thing is that the either the coagulopathy will be the primary medical condition, mean there is the genetical problem, some problem within the gene, and as we all are aware about the gene, that the gene is the segment or part of the DNA that is responsible for the production of either structural or the functional protein. So either it may be the primary medical problem or the due to some other complication or the disorder. So this is the definition of the coagulopathy, that the coagulopathy is a process in which the body ability to clot is impaired. And this may be either the primary coagulopathy or it may be the secondary coagulopathy. And bleeding can occur either spontaneously or due to some medical or dental procedure or even due to some trauma or accident. And the bleeding may be either for a short period of time or it may be for a long period of time. So this is regarding the definition of the coagulopathy. Now let's proceed toward the sign and symptom or the clinical manifestation of the coagulopathy. So जिस तरह हमें पता है कि जब normal coagulation process ना हो तो फिर different sign and symptom may appear in the body. Some of them, the following symptom may occur spontaneously, as it is referred here that the due to some medical or dental procedure or due to some trauma, these symptom will occur. But also this symptom can occur spontaneously within the patient of the coagulopathy. So the first symptom is the abnormal menstrual bleeding. That is also called, and more common in the woman, that is also called the dysmenorrhea, mean whose menstrual cycle will be abnormal and there will be severe bleeding from the endometrial lining. And then the second most important sign and symptom of the coagulopathy is the bleeding from the mouth or either from the gum, जिसे हम जो है विटामिन सी की डिफिशियंसी की वजह से भी एक डिजीज होती है जिसे हम स्कर्वी कहते हैं. So in the coagulopathy there will be also bleeding from the either from the mouth or from the gum. And then the easy bleeding or bruising is also one of the symptom of the coagulopathy. So this इसे हम जो है डिफरेंट टर्म्स और भी हम जो है पहचान सकते हैं, जैसे कि आपने सुना होगा कि एकाइमोसिस, इस तरह जो है petechiae etc. So these all are the different types of the bleeding within the skin. और फिर जो है उसकी थिकनेस और लेंथ के बेस पर जो है हम उसे क्लासीफाई कर सकते हैं कि आइदर ये petechiae है या ecchymosis है या even simple bruising है. So this is also one of the symptom of the coagulopathy. And then the most important symptom and the first early symptom is the nosebleed, जिसे हम मेडिकल टर्म में epistaxis भी कहते हैं. So these all are the different sign and symptom of the coagulopathy that may be either the menstrual abnormal menstrual bleeding, or either from the gum or mouth, or bleeding within the skin or beneath the skin, and the epistaxis. So these are the different sign and symptom of the coagulopathy. Now let's proceed toward the causative agent or the etiology or the pathophysiology of the coagulopathy. But here I will mention that this video tutorial is just a small discussion regarding the coagulopathy, its causes, sign and symptom, and what should be the treatment of the coagulopathy. And usually I will discuss the hemophilia and then the thrombocytopenia. That is one of the subtypes of the coagulopathy. Suppose I will discuss the uh, hemophilia. That is a genetic condition in which the clotting factor is deficient, and that may be either the hemophilia A, B, or C. And then the thrombocytopenia, that is due to the deficiency of the platelet, as platelet play important role within the normal coagulation process. इस तरह की आपने सुना होगा कि जब नॉर्मल जब एक नॉर्मल सपोज दिस इज द ब्लड वेजल्स, जब नॉर्मल जो है एक कट लगता है, सो एज यू ऑलरेडी मेंशन इन द अर्ली स्लाइड्स, तो फिर आफ्टर सम टाइम जो है इस तरह एक platelet adhesion and then the platelet aggregation process happen. This is the subtypes in the coagulation. Platelet adhesion is actually the attachment of the platelet to the non-platelet surface. Suppose the endothelial lining and the blood vessel. So this will be the platelet adhesion, and then the platelet aggregation is actually the attachment of the platelet to themselves. So platelet adhesion will be called as the uh, platelet aggregation. So we will discuss individually each and every types of the coagulopathy, but here I will give a slight touch in this video tutorial. Now let's proceed toward the etiological agent or the causes of the coagulopathy. So that may be either the genetic factors, as I already mentioned, that it may be either due to hemophilia, that is the genetic deficiency of the clotting factors, and up to now the 13 clotting factors are identified. And then anticoagulant drug use. In some patients, the doctor prescribe the anticoagulant medication that may also cause certain types of the bleeding tendency, such as warfarin and the heparin. Nowadays, we use the different types of the derivatives of these warfarin and the heparin. You must hear the term in the enoxaparin, that is the low molecular weight heparin, and that was commonly used in the COVID-19 patient to counteract the excessive coagulation process that may cause multi-organ failure and eventually the death of the COVID-19 patient. Then the long-term use of the antibiotic is also one of the reasons for the coagulopathy, because the antibiotic can affect the normal flora of the human body, and due to that, the coagulopathy will occur, and the normal coagulation process will disturb. And then due to the liver diseases, as the liver produces different types of the clotting factor, so so one reason ये भी है कि liver disease जो है उसकी वजह से फिर coagulopathy हो जाए, जिस तरह मैंने पहले डिस्कस किया कि coagulopathy, either it will be the primary coagulopathy or the secondary coagulopathy. So primary coagulopathy is mostly due to some genetic factors, while the secondary coagulopathy is due to the certain type of the liver disease or certain types of the bleeding or the blood vessel problem. So that will be the secondary coagulopathy. And then the viral infection is also one of the reasons. And then the vitamin K deficiency. You must be familiar that the vitamin K play important role in the normal coagulation process, as vitamin K help in the activation of the factor 2, 7, and 10. So I'm again I am that the vitamin K play important role in the coagulation because it helps in the activation and in the production of the different types of the factor like what factor 2, 7, 9, and 10. And these different types of the factor are involved either in the extrinsic pathway of the coagulation or the intrinsic pathway of the coagulation. So these are the different causes of the coagulopathies. Now I will proceed toward the treatment of the coagulopathy, but before that, if I discuss slightly here that what should be the diagnosis of the coagulopathy. So we can diagnose coagulopathy through different types of the test, like the APTT and then the PT, that is the prothrombin time, and the other one is the APTT, that is the activated partial thromboplastin time, or even in certain anticoagulant therapy, we can prepare the INR, that is the international normalized ratio. So these are the different tests and the ways through which we can diagnose the patient of the coagulopathy and to check for the different types of the bleeding or the blood disorder that may cause further complication like the ischemic heart diseases, MI, or the stable angina, unstable angina, etc. So now what should be the treatment of the coagulopathy? So for the coagulopathy, the first option is the immunocaproic acid. That is the which prevent the breakdown of the blood clot and may be used to limit bleeding in the mouth during dental procedure. So actually it is the agent that prevents, suppose if this is the normal blood vessel and after some time, if the normal coagulation process happen and the bleeding is stopped, and the mesh network is formed due to the activation of the factor 1 fibrinogen to the fibrin. So this is actually the aminocaproic acid as the agent that actually prevent the blood clot further breakdown. If the blood clot is not broken down, so that will be, so we can through this way we can prevent the coagulation, the abnormal bleeding process. Now, the second way through which we can tackle the coagulopathic patient is the birth control oral contraceptive pills, which may help control excessive menstrual bleeding. As I have already mentioned in one of the symptoms of the coagulopathy, that was the abnormal menstrual bleeding. That is also called the dysmenorrhea. So for that we can use other medication, but we can use the patient and the woman is not pregnant, so we can also use the oral contraceptive pills to prevent the different types of the menstrual bleeding. And then there is the desmopressin, that is the desmopressin acetate, that is the antidiuretic agent, and which may be used to release blood clotting protein stored in the body and in case of mild to moderate coagulopathic condition. So desmopressin is actually this is the substance जो abnormal जिस तरह मैंने पहले बताया कि नॉर्मल जो प्रोसेस में होता है लीवर डिफरेंट क्लॉटिंग फैक्टर्स फॉर्म करता है और फिर ये जो क्लॉटिंग फैक्टर है ये फर्दर कोएगुलेशन करता है. सो डिस्मेप्रेसिन एसिटेट जो बॉडी में ऑलरेडी स्टोर जो क्लॉटिंग फैक्टर है उसे सिक्रेट करता है. And then the other option through which we can treat the coagulopathic patient is the plasma-derived factor can be given to the coagulopathic patient. Especially, we use this therapy for the hemophilia patient because there are different types of the hemophilia, like hemophilia A, that is due to the deficiency of the factor 8, then the B, that is due to the factor 9 deficiency, also called the Christmas factor, and then the hemophilia C, that is a rare type of the hemophilia, and that may be either due to the deficiency of the factor 11. So this was a slight touch regarding the coagulopathy, that what is the actually coagulopathy and what are the causes and sign and symptom of the coagulopathy and how we will manage the coagulopathic patients. So, and then I have draw a little background toward the normal coagulation process, and then there are two pathways for the coagulation that may be either the extrinsic pathway or the intrinsic pathway. And due to some genetic factors or due to some secondary factor, the coagulopathy will occur, and that may cause further problem to the hemophilic or the other different types of the coagulopathic patients. So this was all regarding the coagulopathy. Thank you for your time and stay happy and take care of yourself.